I am Scott Baker. I'm the medical affairs director for the clinic. My responsibility is basically to make sure that from a medical and from an operational standpoint that everything's running appropriately. And I'm also in charge of investigating or getting more detail on possible additional procedures that we might be interested in pursuing. I have a degree in chiropractic medicine. Um, I've practiced in the past. I've had my own clinic for about 15 years in Florida. I decided to move up to Georgia, and while investigating what I wanted to do here, met Dr. Morganstern, and we kind of clicked, and I liked what he was doing, and he invited me to be a part of what he was doing in this office. Dr. Morganstern's philosophy is take care of the patient. And he does not care where he gets a procedure, what he learns, who came up with it. What he cares about is it going to help his patients? As a result, he researches far-ranging. He gets techniques and evaluates studies from all over the world and pulls those together into, along with what he adds to that, in order to benefit his patients. And I thought that was just a great way of doing things. Well, there's a number of different techniques, and we've investigated them all. I've been with Dr. Morganstern at this time over 11 years, and just in that period of time, we've gone through many iterations. The situation we found is on the market today, on the internet, you can get all kinds of different things, different types of devices, and different suggestions on what to do. But this is a urology office. We are very, very concerned not only with helping a patient get what they want, but keeping them healthy and safe. So we don't go for processes and procedures that could modify that, could change that. We want our patients to be able to not only enjoy what we do with them to get what they're trying to get, whether it's greater length, greater girth, but we want to be in a safe manner so they don't have to worry about it in the future. One of the most effective methods that's out there, or at least one of those methods that's used a lot, is traction. All right, penile traction is just what you'd expect. It's pulling on the penis until it gets longer. There's all kinds of mechanisms to do that. What we discovered, though, is that all by itself, it's not that effective, and it can cause a lot more damage. What we were able to do was make modifications utilizing traction, but other processes in order to make it safer and give a good result to the patient. We really did this because of our expertise in Peyronie's disease. And Peyronie's disease is the abnormal buildup of fibrous tissue in the penis that most often is seen by a patient with an abnormal curvature when they have an erection. Now, you don't always get that. You can have the fibrosis there without that curve. But the other thing you get with Peyronie's disease is you get shortening of the penis and loss of girth. And in order for us to treat patients with Peyronie's disease, we have to address those two concerns as well. So we came up with techniques in order to restore some of that length and some of that girth. What Dr. Morganstern discovered is those techniques work well for patients who do not have Peyronie's, who are just trying to lengthen their penis in this case, without a surgical procedure. And those are the procedures that we're utilizing now. It does work. If you do it correctly, if you do it safely, you can get a bit of additional length. The problem with just using a traction system is that all you're doing is stretching tissue that already exists. It's like playing with silly putty. Okay, you can stretch it, but you're restricted by what tissue you've already got. What our procedures do is we try to influence additional growth of tissue so that there's more tissue to stretch. We've got a multi-tier type system. Basically, we utilize a safe method of lengthening, stretching, traction. This is a system that's been used for years. It was invented actually at the Mayo Clinic, and we use those techniques here. We also want to increase what we call radial stretching, which is from the center of the penis outward, to the periphery. So you might consider that as girth. And the reason very simply is when you try and stretch something in one direction, you're not getting the full effect. But if you're stretching it in multiple directions, you're going to get more positive benefit from it. Additionally, in order to create some additional tissue and also to keep everything healthy, there's a group of supplements that we provide that actually increase blood flow to the penis, because you always want to have good blood flow. You need to have oxygen and nutrition getting into those cells, and you need to get rid of carbon dioxide and the breakdown products so that the body can efficiently operate. So those supplements do that. The supplements also help control an inflammatory response. And in order to build tissue, you need to break down tissue. Whenever you go to the gym, that's what you're doing. You're building up muscle. You know it because when you're done, you have that burn afterwards. Well, that's the inflammatory process. So the body breaks down that tissue and replaces it with more tissue, and typically a little more than you started with. And that's how you build up muscle. This isn't muscle we're dealing with, but it's kind of a similar way of looking at it. You don't want that inflammation to get out of control. The last thing most men want is a burn of their penis. So these supplements allow some of that inflammation to occur, but control it so that you don't get that kind of an effect. Finally, we use a therapy technique in the office that is designed to jumpstart the process. And what that will do is it increases blood flow significantly into the penis to such an extent that you're actually stretching the tissue from the inside. All of that is external, so there's no needles or anything like that. There's no real discomfort to it. And that's basically what we do. And this is a 90-day program. So you're doing the stretching, you're doing the radial stretching, you're doing the utilization of these supplements. You're doing that for about 90 days, and then we evaluate to see how well things have gone. A lot of it depends on the tissue that you have to start with. A lot of it depends on, actually a great deal of it depends upon how consistent the patient is with actually doing the procedures we set up, because when they walk out the door, that's when it starts. And they'd be expected to utilize the stretching device. It's a vacuum device for the radial stretching, and you use these supplements on a regular basis, anywhere from 2 to 3 times a day for those 90 days. If the person's compliant with the program, we've gotten patients who have gotten an inch with no problem whatsoever. The supplements are well tolerated, so unless you've got specific allergies to its ingredients, which we have not ever had a problem with, by the way, as long as you follow the instructions that you're given, you'll be fine. One of the reasons we chose the traction device that we're using is because it is safe, it is reproducible. And there's all kinds of traction devices, some of them with fancy weights that you hang from your penis, and they're not exactly the safest thing in the world. We tried to, as best we can, stick with devices and procedures that will maintain that safety. Side effects from it or complications, we haven't really had any. Well, as far as the procedures we're utilizing, one of the interesting things that you get is we have a 90-day program. And at the end of that 90-day program, obviously, you can stop. You don't have to continue anything at that point. Some patients, they get a lot of their change, their increased length near the beginning or middle of that period of time, in which case continue it longer probably isn't that desirable. But we have a lot of patients where they're still, when they're getting towards the end of that 90 days, they're still getting a noticeable change in length. And to those people, we say, keep going. You own the traction device, both of them. You have the supplements. In most cases, you don't have to really continue those at that point. But if you want to, you can get them from us. And the rest of it is you doing the work. So you can continue that longer. It's safe to do that. That's not a problem, as long as you follow the procedures that we've already set up. In terms of lengthening from other systems, just using a traction device, you have to be careful with that, because you can overdo that because the devices aren't as safe. Well, if you can imagine attaching a weight to your penis, let's say 6 pounds, for example, and instead of gently lowering it until the tether going from the weight to your penis is tight, if you accidentally or on purpose drop it, you can imagine some of the damage that could occur. You could get penile fracture. You could get significant inflammation if you overdo it. Uh, there's a lot of different types of things that can happen. People can overdo the utilization of these, and again, you can overdo utilization even with the traction device that we're using. But we have specific instructions. If you follow that, you'll be fine. But you always have those people who go, well, more is always better. No, more is not always better. Stick with the instructions you're given and you will get a good result.